And he's real happy about what happened yesterday in the U.S. House on Capitol Hill in Washington, a vote of 392 to 26. The 21st Century Cures healthcare reform package passed. It includes mental health reforms from Congressman Murphy's Helping Families in Mental Health Crisis. Congressman, good morning.
Good morning. Great to be with you. Yes, it was a good day yesterday.
Yeah, explain briefly, if you can, what the impact of this is.
Well, the impact of this is basically my mental health reform bill, which the House passed last July, but was trouble getting through the Senate because of amendment arguments over there. So we put it in a package of other reforms for the Food and Drug Administration and medical research, and passed a bill that the Senate will not be amending. We expect them to vote on it next week and head it to the president's desk. This includes my bill, which is organizing the 112 federal agencies that deal with mental health in a not very effective way now, starting a new post of the Assistant Secretary of Mental Health and Substance Abuse, putting more funding into and more psychiatrists, psychologists, clinical social workers, and other counselors across America, because half the counties in America don't have a mental health worker in them, doing more focused research, more applied funds for states and communities, more accountability for how money is spent, more hospital beds for people with psychiatric emergencies, a whole host of things that we had to do and move forward with.
Let me ask you to let me give you a little anecdote, and you can tell me how your bill is going to take care of this issue. Let's say, and I'm just making this up, let's say I have a member of my family who is mentally ill, and I'm concerned not only about the illness, but how it might affect other people. You know, who knows, something like this might get violent, and I want this person to have some help, but this person won't acknowledge that he or she needs help and won't agree to go to the hospital, see the doctor, or whatever needs to be done. And right now, I guess I can't do anything about that, but your bill changes that some. Is that right?
Our bill is part of the change here is to open some areas of communication between doctors and family members, not to get into the details of their therapy or what they talk about, but working with Health and Human Services to come up with some better regulations that give a window of what we call compassionate communication. So family members can not only give information to the doctor of the history and background, but doctors can at least say, here are some other things you need to know. Here's the next appointment. Maybe the person has cancer or diabetes or needs a neurology checkup. That's there. The other parts of our bill that will help with the issues of violence is specific funding to train policemen of how to handle these situations, because so often it erupts into a violent situation because the police may not have the training of how you handle someone with mental illness. By having easier access to treatment early on in life can make a big difference, too. We know a person who is in treatment with severe mental illness is 15 times less likely to engage in violence than someone who is not in treatment. So having that easy access is going to be important, but it still comes down to this whole issue. Some of the hurdles we'll have to face in the future is dealing with when a person is resistant to getting treatment. It's a gradual, but it's a focused and continuous process to help get them there. And as long as the person really doesn't have access to treatment, as much as you may beg them to go get it, it really doesn't make a difference. So our bill, by having easier access to treatment from the onset, we believe will help a lot of families here.
Well, Congressman Murphy, thanks a lot for talking with us about it. I appreciate it, and congratulations.
Thank you, PJ.
Congressman Tim Murphy on the live line, Republican, 18th Congressional District here in southwestern Pennsylvania, talking about his Helping Families in Mental Health Crisis, part of the 21st Century Cures bill that was passed by Congress yesterday.